Well, my name is Jill Fisk, Director of Mission Services for the Catholic Health Association. And the way I came into the work that I do at CHA in mission integration, where I serve in areas of well-being, spiritual care, and mission. I came into this work not intentionally. It was one of those kind of places of I call it sort of a nudge from God, where I really felt sort of the tug on my arm of, I want to show you something different. I've been in ministry pretty much my entire career. And when I learned about what mission integration was in Catholic healthcare, I thought, okay, there is something here that's for me, bringing the very best of spirituality, of a larger perspective, mission, vision, values, and the administrative and executive skill set. It was very intriguing, and one thing led to another. I represent over 700,000 coworkers in Catholic healthcare. We have over 100 member systems that are Catholic, it is their aim to offer compassionate care through who we are as a Catholic health ministry. And so each of those facilities, each of those health systems represents all kinds of people who say yes to this work. And you know, I look towards the sisters, and as the religious orders founded congregations and really did the work of healthcare on the ground, they were open. It didn't matter who they were offering care to or who came alongside them. Like, I remember when I first came, I worked for Mercy Health out of St. Louis. And when I went through coworker orientation, I remember sort of just the beautiful surprise of learning, as a Protestant, learning how Protestants came right alongside Catholic sisters, and the work wouldn't have gotten done without them. And so that it's very affirming to me, and I realize what a wealth it is, not only for the patients that we have religious diversity of our staff, our caregivers, but representative of the community. Well, I'll tell you, it's been surprising to me when I was given the area of spiritual care to help convene, to help resource. I don't come from this work with spiritual care background. I'm a spiritual director, but that doesn't make me a chaplain. I've been so surprised at the way that our chaplains are really, they're the ones that we have to look to drive this work. They are the experts when it comes to religious diversity, and I don't think organizationally we'll get where we need to be without their sort of subject matter expertise, because they're the ones that have, not only have they been trained, they understand the nuance, they understand faith tradition, symbols and use of time better than anyone within healthcare systems. You know, I think we've made great strides within the last couple of years in terms of what we at CHA call putting our own house in order. The sort of strides that have been taken amongst coworkers, within structures and policies when it comes to things like implicit bias, and empathy training, and all of the good work that's gone on as a result of racial diversity and disparities. But yet we have great challenge when it comes to LGBTQ. And then we also have great challenge when it comes to religious diversity. So these are all areas of belonging that people are hungry for, to make meaning, to come to work every day as whole people, knowing full well that if we say that they can bring their whole selves to work, how is that really modeled with the use of time, with the use of language, with symbols and schedules? We have great work to do, and we can't do it alone. But I think the trajectory that's been set as a result of the last few years really opens us up greater than it has in the past. So I come to this work as a Christian. I don't come to this work as a Catholic, although I do the work of Catholic health ministry. I think my own sort of diversity, even within Christianity, serves me quite well. My work in spiritual direction serves me quite well, to stay open, to ask the questions, and to be a theological thinker that knows that we serve a God of mystery, not a God who gives us all the answers. And so the deeper I go into faith, the deeper I move into spirituality, the more I realize really how big the world is, and how there's so much more to the person in front of us that can be seen.